There have now been a number of studies which have looked at women going through infertility treatment or even high-tech treatment like IVF to see, what happens if you do some kind of psychological intervention. And for the most part, the research shows that group interventions seem to be more effective than individual. And I'm not sure if that means that individual therapy isn't effective, which I don't like to think of because I'm a therapist, or it simply means there's been more research on groups. I think for women going through infertility, it is such an emotionally isolating phase that being with other people who get it is really powerful. And so, someone can walk into a group and say, oh, my sister's pregnant for the third time, and everyone in the room goes, oh my God, we're so sorry. Which out in the real world, that sounds pretty sick, but in this world, when someone gets pregnant, it's actually really hard. So support groups are highly effective in terms of reducing distress. Other research has shown that what we call mind-body groups or cognitive behavior groups, which are actually skills acquisition groups, not only reduce stress, but also are associated with higher pregnancy rates. So we've published several papers, both of which, as I said, showed that stress levels went down, anxiety went down, depression went down, anger went down. But in a study on women sort of garden variety infertility patients, the pregnancy rates pretty much almost actually tripled compared to the control group. And then a study we published a year or two ago where we looked at people doing IVF for the first time. The ones who did a mind-body program more than doubled their pregnancy rates compared to the control patients. So I think now it's pretty clear that being with other women is very helpful to your psyche. And I think being with other women and all learning specific skills to reduce stress is good for your psyche and can lead to increased pregnancy rates. Acupuncture is trickier. There have probably been now 20 or 30 studies on acupuncture, and the results are sort of all over the place. What it comes down to is there have been some good studies that have shown that pre- and post-embryo transfer acupuncture is associated with higher pregnancy rates. There have been other studies that have not shown that, but I suspect it has to do with the quality of embryos. If you look at the original study, it was done only on women who had good quality embryos. Now, if you think about it, if somebody has abnormal or bad quality embryos, you can do acupuncture for 10 years and it's not going to change their embryos. But if they have good quality embryos, then it makes a little bit more sense that blood flow to the uterus and a sense of relaxation may in fact be associated with higher pregnancy rates. So I do recommend acupuncture to all my patients. I think it's a good thing to do.